Collaboration, from my perspective, is critically important, both between stakeholders, among stakeholders, but also with including the federal government in that. We've done a lot of work on disaster preparedness, and what we've seen happen is the government has one silo where they're working in, and then the other stakeholders are either working within their own sectors, or sometimes they're crossing over, but you're trying to get medical records in a community when they're not available, or you're trying to get medicines or medical supplies to people. And we literally were having CEOs of healthcare entities calling their personal friends to try to get airplanes and trying to get things into people. So what we've seen, particularly since Puerto Rico, is that the federal government has realized that they need to interact better and have more interaction with stakeholders in the private sector. And so we're starting to work together. The National Academy of Medicine is working together. And you're already seeing, although we certainly haven't had the severity of situation that we had last year, about seeing things work better. So that's one example. Another example where I think stakeholders working together is critically important is in the opioid space. You can't just address the opioid issue from a law enforcement perspective or from a healthcare perspective, but everyone really needs to come together and try to address the issue. And when that started to happen, through a lot of efforts, both legislative and on the private sector side, in the healthcare community and non-healthcare community, we're slowly starting to see the death rate go down.